Hi, everyone, and welcome to another episode of the NEMTAC video series. I'm Joel Smith, and today I'm joined by someone who brings a truly unique and powerful perspective, Ann Soliman, the founder and CEO of Care Connect. Ann wears multiple hats as both a home care and NEMT provider, as well as a National Policy Committee member for the Home Care Association of America, and is a strong voice when it comes to raising standards across the industry. Ann, thanks so much for being here.
Oh, thank you so much, Joel, for having me.
So, really excited for this conversation. Let's dive right into it. So, one of the
Sounds
biggest goals of this series is to make standards feel less like a buzzword and more like something tangible. So, from
good.
your viewpoint, someone who lives and works this daily, what are NEMT standards to you?
Well, I wish there had been a little bit more of a standard when I first started, I'll tell you that. But to me, standards really mean clarity, I guess. When I think of standards, I think of clarity. So when you enter into an industry, especially folks that don't have a whole lot of healthcare background or experience, having a standardization of how we onboard drivers, how we train drivers, how we run our operations, how we handle passengers and passenger incidents or concerns or emergencies really allows us to have clarity and understanding of what the expectation should be for our service. So to me, when I found NEMTAC, really helped me because coming from the healthcare side, we have a lot of um, licensure. We have a lot of oversight with different organizations, accreditation institutions, things like that. So typically we have some kind of care standard that we have to meet, whether it's a state licensure or again, accreditation agency. So with NEMTAC, I think it really fills a really big gap in the industry. And so I was really glad when I found you guys.
What would you say to those is you've been applying some of your standards and some of the things that we've put out there as NIMTAC? How have you seen that help in things like consistency, patient experience, safety, getting the staff up to speed? What's that look like for you in some practice so far?
Really, it helped to really guide our entire operational framework. So when we first started, we had our ideas of how we thought things would be, how we should operate, how we should structure things. When I found that a lot of the different NEMTEC standards that were already published, I really took a deep dive into those, reading them and comparing them and contrasting them to what we had originally had in place. And we really just created our framework based on the accreditation standards that NEMTEC has provided. It really allowed me to streamline our processes from training our drivers, what kind of trainings are going to be required, what kind of onboarding experience they're going to have, from orientation to hands-on training, securement training. It really has provided us a higher level of safety. It made sure, to me, it helped to feel like I was checking all the boxes, that I made sure I did my due diligence to have the right safety program in place. Because we're holding people's lives in our hands. I know some people don't always view it that way, but we're treating a very vulnerable population that typically have medical needs as well as mobility needs. And so their safety and their well-being is literally in the hands of the drivers that you entrust with your vehicles out on the road. So I really don't take that lightly. And so having that standardization really allowed us to, in my opinion, have a really comprehensive program from HR to safety to operations. And in turn, that gives the passengers a really good, consistent experience. So I think also when I think of standards, I think of consistency. So we want to make sure that no matter what driver goes into our vans, whatever dispatcher is on duty at that point in time, that the experience will be the same for our community partners and our passengers and their families, so that I can feel confident putting them out on the road knowing that every trip, every mile, every experience, and every interaction should be similar. There might be variances, but the root of it should be the same.
Of sitting on the Home Health Agency national organization, where
Mhm.
you've seen how some of the standards that you put in place there take root as an industry. what were some of the lessons learned that that you saw was applied that you think could be applicable for the NEMT world and what we're doing here at NEMTAC?
Yeah, I think really the approach I had when it came to home care really now I feel like translates very well into NEMT, and the fact that a lot of home care in the past had been unregulated and not as standardized, very state specific, region even specific. So I feel like when we started implementing and trying to implement more national standards or encouraging accreditation with some of our national organizations, it gave home care a seat at the table, so to speak. And I feel like that's kind of where NEMT is at right now. It is a healthcare adjacent industry. And that being said, a lot of our payer sources are healthcare organizations. They're, health insurance companies, Medicare, Medicaid. And these people need to see quality, and they need to see that we take our industry seriously in order for them to give us that seat at the table to have a voice to advocate for increased access to care, increased compensation, better reimbursement rates. And those things really come from doing your homework and doing your due diligence. If you want to ask for those things, being able to go to Washington to advocate for those measures, you have to have a standard. You have to have be able to give them an expectation of this is what our industry is doing. This is how we're improving. This is how we're monitoring and tracking what we're doing. This is how we're guaranteeing and ensuring quality services are being provided across the board. Continue doing in the NEMT space is really just trying to let providers and operators know it's not a bad thing to have an organization ask you to meet a certain standard. Because really those standards originate in passenger safety and passenger experience. And just let other providers understand that it's important. And if they have concerns about specific aspects, to get involved, to say, hey, these are concerns I have. I don't know how this could be practically implemented in my day-to-day. How is this going to logistically work for me based on where I'm at and where I operate and what kind of service lines I provide. To get involved, let your voice be heard, and let us have a dialogue as an industry to come up with good standards.
As a provider too, from the medical side, and you work close with those hospitals and with those hospices and those suppliers. So how do you feel them as a partner to the MT provider, they're going to benefit from us implementing more standards into our industry?
Oh, they will greatly benefit from us having a standard of care, because in all reality, I can give you an example. So we partner with a large hospital system here in North Texas, and their biggest concern was, their legal responsibility. So they have very deep pockets. So if they entrust an NEMT provider to take a wheelchair bound patient and discharge them home, and that something bad happens, a bad outcome, they don't secure them properly, they don't have the right equipment, the driver is not properly educated, whatever the case may be, and something bad happens and the hospital was paying for that trip, they now have a joint liability in that situation. And so it was a big concern to them not having a high standard in the partners that they were working with. So they've started to even have their own standards, which actually NEMTAC, having a NEMTAC CTS on all of their drivers is part of their standard, as well as certain, WC-19 wheelchairs being used, things like that. So they have a big risk when they're working with community partners like us, because they could essentially be sued for a large amount of money, and that's not something they're willing to want to take on. And as well as passenger experience, if they are providing or endorsing one of us as a community partner to provide this transportation, and our drivers come in and they're unprofessional, they don't know what they're doing, they don't know how to properly handle this patient's and passengers' needs, it reflects poorly on them. And, they rely heavily on patient satisfaction surveys for reimbursement, and those things can implement, or impact their patient experience. When that's the last thing that they experience on the way home, that's probably going to be the last thing in their mind, not maybe the first thing that happened in the hospital stay. So hospital systems in particular really have a very big stake in in having standardized care for NEMT companies. So one thing that we do is, we do a lot of hands-on education with those referring partners so that they understand, hey, these are the standards that we have. This is how we're operating. Does this work for you? Is this going to be, do we need to tweak anything as far as our communication? And just providing that extra level of education to them so they know, again, what to expect, that they can have a consistent experience. And if not, they know who to go to at that point, and we will correct it. So yeah, I think that hospital is just one example, but you could really duplicate that out to any number of our referral partners, skilled nursing facilities, doctors' offices, surgery centers, any of those things. It's very much an impact on them when community partners like us operate well, and just as much if we don't operate well. So.
Thank you again for taking the time and the insight you shared for everything you're doing to move both the needle here at EMT and for home care. And for everyone watching, stay tuned for more videos in this series. And if this conversation resonated with you, don't miss your chance to join us in person at Transform 2025 this August in Dallas. We'll be diving into these conversations live with industry leaders like Ann and from all over the country. Thanks again, Ann.
Thank you so much, Joel. Have a blessed day.
You too. Thank you.